Alhamdulillah, Alhamdulillah. So it is customary for all our guests to give a quick introduction about themselves and the area of expertise they are working in, and a bit of background about themselves as well. So let's start with you.
Lovely. So my name's Rachel. I'm a nurse by background. So I'm a registered nurse. My background is in general practice nursing. However, I now work for the public health, or as you said, NHS England immunisations team. So I've always had a special interest in immunisations, and our team covers the large area across Hertfordshire, Bedfordshire, Luton and Milton Keynes, and we focus on immunisation as we're all very passionate about it. So we are a team of nurses. It's something that we know a lot about, and it's something that we're all very passionate about. As I said, we like to talk about a lot. So I'm not sure if you were talking there, but it went a little bit glitchy. I do apologise.
This is correct. Oh, I think so. My internet connection is a bit kind of glitchy today for some reason. Technology and voice. Can you hear me? Oh, it seems like I'm frozen.
No, it's usually me that has the problem. But I think it might be your end, unfortunately. But yeah, I can hear you now. But sorry, I couldn't there for a minute, so I do apologise for that.
Apologies. No problem. It happens, unfortunately, as the technology is what it is. Sometimes it starts glitching at the time. And funny enough, I have two computers here. One I can see myself freezing. Second one is freezing itself. So unfortunately, that's what things are, how things are electronic wise. Anyhow, so I know the vaccination program is going on since last how many years? Few years, if I'm not mistaken.
Sorry, I couldn't hear you then after you said last few years.
Rachel, hello.
Hello, sorry, you went completely quiet again.
No problem. Okay. Unfortunately, I'll definitely try to set my computers properly. Unfortunately, but anyhow, in terms of the program itself, so we are talking about flu. So what is flu?
Yeah, so flu is a viral illness. It's very contagious, and it's spread mainly by droplets, so coughs and sneezes. It can affect healthy people, and it can affect people with underlying health conditions. So we often hear flu described as a bad cold. It's not that. It can cause serious health complications. People can be hospitalised, and very sadly, in some cases, they can die from the flu. The most common symptoms are fever, being very tired. People with flu report being bedbound for days, sometimes weeks afterwards, muscle aches, headaches, all those sort of things. But it can also cause pneumonia, breathing problems. So those are the things that we try and avoid with the flu vaccination. The vaccine is a very effective way of preventing these serious complications from the flu.
Can you? So, in terms of the vaccination, do you know why we vaccinate pregnant women for flu?
Yeah, so pregnant women are included in the programme. So any stage of pregnancy and any pregnant woman is eligible for the flu vaccine. This is because when you're pregnant, your immune system is naturally lower. So people who are normally fit and healthy are much more prone to having complications and serious illnesses from viruses and flu. So not only does it protect the mother, but the antibodies pass to the baby as well, and gives them protection, as children cannot have a flu vaccine even if they've got severe illnesses. They cannot have a flu vaccine until they are 6 months old. So by mother having the vaccination in pregnancy, it protects baby until they're old enough to have their own anyway. So really important for pregnant women.
Mm-hmm. So if someone is fit and healthy, why do they need a flu vaccine itself?
So again, as I said, it's also about the immune system being lower, but also people in general. So if people are eligible, then the more people that have the flu vaccine, the less cases there are, the less spread, and healthy people can catch the flu as well. So people that are working as healthcare workers, for example, they can often be in contact with people with flu. So again, it protects their patients, it protects them, and it protects their family. So, and being pregnant, that's even more important. Even if you're normally healthy, doesn't mean that you couldn't contract a very serious case of the flu.
Mm-hmm. So when is the best time to have flu vaccine? Which is always very unique, because we don't have to have anything, unfortunately, nowadays.
Yeah. Sorry, was that was about the timing?
When is the best time to have vaccine?
Yeah. So anytime of pregnancy, from as little as when you find out to if you've been thinking about it but you're not sure and you're now due to give birth, then that's absolutely fine. It will still offer some protection. So any time. And in terms of time of year, there's sort of two questions there. We offer the flu vaccine from autumn, so we start early September, right up until March. So while we like people to get it as early in the flu season as possible, now we're mid-November, we still wouldn't say, don't cut it off. Still go and get it any time during the winter months, autumn and winter months. You can access a flu vaccine, so as early as you possibly can. I think I've lost Fahad now, so I'll just wait for him to come back on.
Astaghfirullah, 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 astaghfirullah.
Hi, sorry. Unfortunately, my internet was literally playing up at the moment, and for some reason, one laptop is perfectly working fine, whereas the other one is going down. Sorry about that. I was asking about the flu vaccination in terms of the best time to have vaccine, and I know you have answered that, and that's the time I've disconnected myself. So.
I think it's gone again, unfortunately. Are you back?
Yeah, sorry about that. So when we talk, when can a pregnant woman get a vaccine? That's something which I wanted to ask you.
So when was that? Sorry.
Yes.
Yeah. So any time in pregnancy, literally from a few weeks pregnant, right up until the end, and they can sometimes they might be offered that at their maternity unit. So I do know that some of the local units are doing. It does depend on what staff they've got on the day, but they do try and endeavour to catch women at antenatal appointments and offer it there, which you see is really convenient. Alternatively, you can also be proactive. If you know you're pregnant and you want your vaccine, you don't have to wait. You can either ring your GP surgery or go to a local pharmacy, might be a booking, or just go speak to them, and you can get your vaccine that way. So so the timing of it doesn't really matter at any point in pregnancy, but you might be offered around the sort of early booking stages antenatal appointment, which is usually might be wrong here, but sort of post 10 weeks or so. But if you want it earlier than that, then please do access GP surgery or pharmacy.
Now, one of the things people always ask, especially for pregnant women, because my missus was pregnant at one time, so they wanted to know if I had a vaccine before, like for example, you had a vaccine in February time, March time. Can I have another vaccine in about September, October time, November time? Will it be okay, or will the January, February one will cover me all the way through?
Yeah, so the flu strains change. So what they do, just briefly, is they look at what's happening in Australia. Their seasons are about 6 months ahead. So they look to see what strains of flu are mostly in the communities, and then the teams who make the vaccines will put those strains into their vaccine for the next year. So they're different every flu season. So if you've had one in March because you were just pregnant and it comes to September and you're pregnant still, as you would be, then yes, you can have the vaccine again. It's usually a different vaccine by that time. So if it's a different flu season, different vaccine, and you're still pregnant, then yes, you can have it. If it's a different pregnancy, then again, yes, do have it, because it doesn't unfortunately cover for every year. You do need to keep having the flu vaccine every year to provide the best protection. Every flu season that you're pregnant, you need to have a vaccine.
And one of the myths which people always say is that, oh, I had a flu vaccine and I get flu from it. Is it true?
No, we hear this one a lot. As I said at the beginning, I'm a nurse by trade, so I've given a lot of flu vaccines in my time, and I've had this one many, many times. So sometimes if you're brewing a bit of a virus that you didn't know about, if you've been a bit unwell, you don't know about it, but you might actually catch, you might make your sort of viral that virus that you have a little bit worse, but it's not the flu, and it cannot give you the severe flu. But you may have symptoms such as aching, soreness in your muscles, a bit of a headache, sometimes a slight temperature, generally feeling unwell, but it's not the flu, and it won't be as severe as the flu was. So we don't want people to be put off by side effects, because for some people they don't have any at all, and the risk of the flu is much higher than the risk of severe side effects.
On this note, I like to involve our listeners as well. Please get in touch with us by sending your messages or your questions via WhatsApp on 07779 481822. I repeat, 07779 481822. Or you can send messages via Facebook app or YouTube link, or Facebook link of Inspire FM. So if you go to either Facebook or YouTube sections of Inspire FM, you can see the live link. Click on the live link. You can view us. You can hear us. Plus, you can send us the messages as well. Your own, if you have any questions or queries or your experience. It's not always questions and queries. Sometimes you like to share your experience, how your experience was. Were you okay? Were you not okay? Were you happy? Were you sad? Hey, anything can happen. Anyhow, let's go back to our topic. So in terms of the is there anyone who cannot have flu vaccine? Because always people make excuses. They say, oh, I can't have flu vaccine because I have X, Y, and Z. So is there any reason people cannot have or should not have vaccine?
No, it's actually a very small group of people that can't have the vaccine because it's not a live vaccine. So that takes away a lot of the limits that we sometimes face with vaccines. So it's very safe. We also, there's people who may have had an allergic reaction to a flu vaccine before. So a severe, as you might say, anaphylactic reaction where they've had to have adrenaline, or very, very severe reaction that they've had to seek medical advice to the flu vaccine before. We tell those people to avoid it, but there'll be very small numbers. Another one with flu vaccine that comes up a lot is allergy to eggs, which we often think about children, but there are some mild almost molecules of egg because of the way the adult vaccine's made, but they're so tiny that really only people that, again, have had a very severe allergic reaction and been in intensive care would avoid in that situation. And there are actually other vaccines that we can offer for people with egg allergy as well that don't have that egg protein in them. So as I said, the numbers of people that do need to completely avoid the flu vaccine are actually really, really small. So encourage all people, even if you're unsure, please have a chat with a health professional, nurse, doctor, pharmacist, and they'll be able to check your history and make sure that they find the suitable vaccine for you.
And some people, because they still think that it might not safe for the baby if they're pregnant and so forth. So is it safe for the baby as well? Correct?
Yes, yeah, it's safe. As I said, it's an inactivated.
It transferred immunity.
Sorry about that. Did I interrupt? Yeah, it's very safe. There's lots of data to show. It's been going on for a few years now. Quite a few years, possibly coming up to a decade, that women have been having this flu vaccine in pregnancy. Lots and lots of safety data. We know that non-live vaccines are very safe for pregnant women. And if anything, the opposite, they protect the baby. So that's why we really encourage it, as it's not just the pregnant mum that we need to think about, but it's also that baby. As I said, babies with even with underlying health conditions don't get to have a vaccine until they're 6 months old. So this is their only opportunity to actually provide protection for the baby, is by mum having the vaccine.
So in terms of the those mums who develop gestational diabetes or any other health condition during the pregnancy, they can also have flu vaccine, correct?
Yeah, we'd encourage them even more than the sort of healthy mums as such. We encourage everybody, but especially those with underlying health conditions as well. You're more at risk of contracting flu. Diabetes definitely can increase your risk of developing flu. So that is something that we would really encourage, is all women who are in an at-risk group in particular, please do really strongly consider having your vaccine done, because you are at much higher risk of having complications from the flu.
And people always, it's hard to recognize between flu and cold. So in terms of flu, what is the signs and symptoms of flu, and how can you differentiate between cold and flu?
Yeah, well, they're quite similar in a way. Flu is not so much as the cough side, but more of the sort of general aches and pains, muscle aches, feverish, feeling very, very tired. And whilst COVID does have that as well, I think if you're unsure, the best thing to do is to get a test. They're very easily available now on the government website. So if you do have any doubts and you're not sure if it's COVID or flu, then do get a test, which is why we encourage vaccines for both. Because see, if you get COVID and flu, then that could be even more dangerous. So we have vaccinations for both. Both are safe for pregnant women, and we would encourage both of those to be done.
So is there anyone... does it cost anyone to have flu vaccine, especially for pregnant women?
For people who are eligible under the NHS programme, then no, and that includes all your pregnant women, children from 6 months to 2 years in risk groups, children from 2 years plus, usually have to have turned 2 by the 1st of September, but they'll all be invited. 1st of September of that flu season, they'll all be invited for the flu, and teenagers up in school up to year 11 now. Adults as well will get a free flu vaccine right from that 6 months of age all the way up to adult 50 years of age in a risk group, 50 to 64 and 65 years plus as well. So there's a large number of people that do get this free vaccine, but actually if you want one you can seek one in a pharmacy privately, but anybody that comes under the NHS, particularly those pregnant women, you will not be charged for a vaccine. That is always free.
All right, okay, that's good, because it's really hard. Sometimes you do not know when you can have it, who can have it, and how can we have it. Now, as you have mentioned about the children's that they cannot have vaccine till 6 months. What age they can have flu vaccine then?
So it's a very wide range of children now. So the 6 months to 2 years old program is for children who are in those risk groups. So this may be things like severe asthma, so having steroid inhalers, children who have problems and sometimes learning disabilities, they can have be eligible as well. Heart problems, diabetes, those children in those groups as young as 6 months can have. There's quite a long list, so I won't go through the list, but it's all available on the NHS website. Then from children that on the 1st of September this year were already 2 years old upwards.
Don't worry, I will ask on the second half of the show.
Oh. Sorry, I missed something there.
No, that's fine, because when it happened, unfortunately, the network is unfortunately creating issues. We are about to go on a very, very short break. So when we come back from the break, we will talk a bit more about the children's side of the vaccination and what vaccines are needed for children's, what age groups and so forth. And definitely we will get more in depth on the children's side. And definitely we have a school vaccination program in play as well. So all these things and more. So just stay tuned. We will be right back. But then definitely in the meantime, if you have any questions or queries regarding our show, please do get in touch with us by sending your messages on 07779 481822, or you can send your message or your questions or comments via Facebook or YouTube link. So stay tuned. We will be back after
AsSalamu Alikum.
this
In Luton
very
and its
short
surrounding
message.
areas, it is now time for Salat al-Isha.
लुटन और इसके मज़ाफ़ात में नमाज इशा का वक्त हुआ चाहता है.
This azan has been sponsored by Ideal Properties. Contact us on 01582 721110 or log on to www.idealpropertiesltd.co.uk.
Allahu Akbar, Allahu Akbar. Allahu Akbar, Allahu Akbar. Ashhadu an la ilaha illallah. أشهد أن لا إله إلا الله. أشهد أن محمدا رسول الله. أشهد أن محمدا رسول الله. حي على الصلاة. حي على الصلاة. حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمد الوسيلة والفضيلة والدرجة الرفيعة وبعثه مقاما محمودا الذي وعدته إنك لا تخلف الميعاد.
Would you like to sponsor the Azan? If so, give us a call on 01582 481 810 or email us on info@inspirefm.org.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Positive week so far. This is the show which we are. This is the health and fitness show. In today's edition, we are talking about the flu vaccination for pregnant women and children. On the first half of the show, we have talked about why pregnant women are necessary vaccination and what kind of a protection they now. With the second half of the show, I'm very lucky to have such a lovely guest today with me. We have Rachel Turner from NHS England today. Hi, Rachel.
Hello.
Sorry about that. So, as I said, this program is broadcasting from the platform Inspire FM today on 18th of November 2021 from as I say, from this platform Inspire FM for all our listeners in Luton and all the surrounding areas of Luton. Now, before we went on break, I did ask Rachel a very, very nice question about which children are eligible for the vaccination, and unfortunately, I have to rudely interrupt Rachel because I have to go on a break. So now I am back from the break. So let's take Rachel. Let's take it from the place where we have left off. So Rachel, which children are eligible for flu vaccinations?
Yeah. So. We've spoken a little bit about babies because of the protection mum passes them. So 6 months to 2 years old, if they have health conditions, I did briefly mention, but just to go over quickly again. So that's things like breathing problems, asthma, sometimes brain problems, and sometimes learning disabilities, immune system, heart problems, those sorts of things, diabetes. Those are the children that come into this at-risk group that offered from 6 months. Once they are turning 2, so if they're 2 years old on the 1st of September of that flu season, then they will be invited regardless of their health. So healthy children will all be invited by their GP to have their vaccine. Then this carries on, and healthy children right up until sort of from the start of school in reception as well, right up until year 11 will now be offered in school. any children that are at an at-risk group don't need to wait to have it at school, and they can have it at the GP surgery. So yeah, almost all ages now. The program's extended. It's quite a large amount of children that are included. But yeah, so the healthy 2-3-year-olds, and then the school program as well. As always, if anyone's unsure, please ring your GP surgery, and they'll be able to guide you on where your child can get the vaccine done.
Now, as you know, we have quite a few anti-vaxxers as well in the whole thing. And since because of COVID, government has drilled in people's mind that, oh, children are okay, they do not need a vaccine in many different ways. So people still think that.
Sorry, you've gone really fuzzy and I couldn't catch the last bit of that, I'm afraid. You've gone really frozen again. Might have lost you again, unfortunately.
Oh, why do my children?
It's very robotic. I can't hear, unfortunately, I'm afraid.
Healthy. So in those children's, especially, why do children's, so my question to you is, why do children need vaccine, especially if they're healthy?
I managed to hear you there. Yeah, so healthy children.
What I was asking is, why? Can you hear me now? Can you believe that the technology was playing up on me so badly that I'm really stressing out now? Unfortunately, technology, we love him, we love the technology, and we hate the technology simultaneously. Anyhow, what I was asking is that why people do definitely ask that, why do children, my child who's healthy, why do they need a vaccine, especially if they're healthy?
So again, a bit like the adults. So actually, anybody who's healthy can still have flu, and it is bad if children contract flu. We don't want them to end up in hospital with it, and it can really give them really bad breathing problems. On the other hand, children are also known as contracting and spreading the virus really easily, particularly in schools, nurseries, those sorts of places. They can really spread the virus around. So if they're vaccinated, their chances of spreading to more vulnerable people is really minimal. So there's sort of two reasons. It is to protect the children, but also to protect people around. So you might have a child who maybe lives with a grandparent in their house. Child goes to school and comes home. They haven't had a vaccine. They might give flu to their elderly grandparents, who may not be able to have the vaccine or may not take to it as well if they have a really bad immune system. So by their child being vaccinated, by children being vaccinated, it also protects the people in society who are vulnerable to flu as well, but also it does protect our children. So there's two reasons for it really there for you.
So one of the other things people do normally ask is that one member of our household is undergoing some cancer treatment. Should my child have flu vaccines? Can they give flu to this person?
So this case, it's even more important to get the vaccine done. So yes, they can. Because the spray the children have is a live vaccine, what we would suggest is it's best, if possible, to get the person who's having the cancer treatment to have their vaccine first. So if they have it and the child has their vaccine 2 weeks later, they're protected. If the person's very, very vulnerable, you can have a conversation with your GP surgery and they may give the child the non-live vaccine instead, so in the injected version. But the reason we go for the spray first is because it's proven to be the most effective in children. But if we're worried about that child being around someone very vulnerable, then we would then offer the injected version. But if they have their flu vaccine first, it offers even better protection. So that's what we would advise.
So in that case, why should a child with asthma have a flu vaccine? Because they already have conditions. So why should they have it then?
So with asthma in particular, we do see a lot of cases of these illnesses, respiratory, breathing difficult illnesses in winter in children. And this is what they end up in hospital with. So child with asthma, they get the virus, the flu virus, then it can make their asthma symptoms worse. It could trigger an asthma attack, or it could make their breathing bad. A lot of children are prone to chest infections with asthma, so they may develop a pneumonia or a very severe chest infection. So by having the flu vaccine for these children, we're protecting them, and particularly as they might be vulnerable having asthma themselves. So we don't want them to catch flu, really important.
Okay, now this is something very unique in a sense, because if I'm not mistaken, up till last few years ago, children just do not have a choice. If they need a flu vaccine, they normally have to have a nasal spray. So now, if I'm not mistaken, there are different kind of vaccines available for children as well. So what are the flu vaccines available for children?
So the nasal spray is the first line. So that's the one that is offered because that's been shown by the scientists to provide the best protection. However, this vaccine does contain traces of porcine gelatin. So we are now aware that that is something that some parents do not want their child to have. And in those situations, their child can have an alternative injected vaccine into their arm, which does not contain any traces of porcine gelatin. So it's to reassure those parents that where before they weren't able to have that choice, that is now a choice for all children. If they do not want their child to have the spray because of those reasons, they can have the injection. Also, some cases where that might happen is children with very severe asthma, children who are very egg allergic as well. So those children may also be offered the injection. But really important to stress, as you said, it's new and it is a choice. It did come in last year, but quite late on in the flu season, I think about December. But this year, straight away, if you feel that you do not want your child to have that vaccine containing the porcine gelatin, then please call your GP surgery, or the school team can do that as well. Just let them know and they'll be more than happy to give an injected vaccine in the arm instead.
Mm-hmm. And I must say, in some cases, I must say we are very lucky in that sense that Luton was the very first pilot for the vaccination program, children vaccination program, for injectable vaccination program in sense. And yeah, it has been a very good uptake from the parents in different schools when the pilots have run. And Alhamdulillah, as you just mentioned, that it is now available for everyone across the country. Because I remember I was part of that study or the whole thing when it was kicking off, and everybody was asking, oh, when can our schools have it, or when can our kids have that? So when you say it's a choice, and will the school immunization team or will schools contact parents to offer these choice? And do parents have to put a consent form or something?
Yeah, so you will all be, parents of school-age children will be sent a consent form. You should have something on there to say if they want that vaccine. If it doesn't, there will be a phone number to ring. So please do ring and speak to them about it. Because, as you say, it is a choice offered to everybody now, and it's really important that people know that they can access this. And if they call the schools team, they can arrange to have that injection done. Just making sure that you give them a call beforehand, or the GP surgery, then because there's not as many of that vaccine ordered, because it's not the larger part of the program, so they will need to order it. So if you get your consent form or you get your letter for your younger child, please call the number on it. Speak to someone and they will make sure that that's sorted for you.
Perfect. So in terms of the side effects, because there is a side effect for everything. So what sort of side effects might children have if they have a flu vaccine?
So they're slightly different depending on which of these vaccine types that we've been talking about. So with the nasal spray, it's just a little quick spray up the nose, one each side of each nostril. So what you might expect from that is a runny nose a couple of days afterwards, sometimes a little bit blocked. Some children might have a slight headache. They might feel a bit tired and they may get a slight temperature, or we would describe as very mild cold symptoms. Very, very similar to the injection, but the injection, you wouldn't get the blocked nose with that. But you may get the headache, tiredness, achiness, particularly in the arm where it's given in the muscle of the arm. That might be achy and sometimes a bit red and hot. And that is the same for adults as well as children. So the only difference there is that the spray up the nose can cause a bit of a runny nose.
And definitely, I know children can have it, but when can a child have the vaccine? So is there any particular time frame? Can they have it in the daytime, nighttime, daytime? What in terms of the timing wise and in terms of the month wise, when can they have it?
So any time of day that it's being offered. So for the younger children, that is GP surgery. The children in the at-risk groups, so that the children with underlying health conditions, they can have at the GP surgery or at the school. So school, you would expect, I know some of them have started, it depends on the area, but they start from September and they go up until December, January time. But as with the adults, the flu season runs right from September through to the end of March. So anyone can, you can change your mind, or you might not be aware of it. So you can get the vaccine done at any of that time frame all through the winter.
Okay. And in terms of the vaccine itself, I know it is very unique to have vaccines which is available for everyone. And you mentioned that some people or some children do have allergies. So what kind of an allergic reactions children may have if they have a vaccine, or if they are allergic to vaccines?
So the one that we ask about is egg or previous vaccines. So if they've had a very, very severe reaction to a previous vaccine, then we would say, please speak to a doctor before deciding whether to have. If it's the egg, then there is alternatives that they can be offered, but it depends on the severity of the allergy. If a child has an egg allergy, but they eat say, baked bread, cakes with traces of egg, then they can still have the vaccine. Anything more severe than that, then do discuss with a health professional before taking it. So things that you'd look for is vaccine. Allergic reactions usually happen very, very quickly. So if you were concerned about your child's health after having a vaccine, please do seek urgent medical attention. So if you're worried about their breathing, if they look unwell, if they become floppy, then obviously call 999, or if you're still in the surgery or school, get immediate help. But these types of reactions are extremely rare, really, really rare.
So when you said the children who have long-term conditions like asthma or diabetes or any other health conditions, why is it important for them to have the injectable more in the GP surgery or in school immunization team?
Yeah, it's because it is a live vaccine. So with the children, if they're unwell with their asthma or on really severe steroids, they might have an even lowered immune system. And a live vaccine shouldn't be given to anybody with a very low or weakened immune system. It's very severe, so you'd normally be under a hospital consultant. So they'd usually advise on this as well. It's because what could happen is that they could have a more severe reaction in terms of the side effects. And that live vaccine could potentially give them more like the flu symptoms. So we would assess them and see which one we felt was best. But it's usually children on like very high doses of steroids, or if they've got active wheezing with their asthma, then we would consider giving the injected vaccine in those cases.
And how many dosage of vaccines children normally need for flu?
Most children is one. But children who are aged 2 to 9, who are in these risk groups and have not had a vaccine before, we would encourage you to have a second dose 4 weeks after the first to make sure that they have a good enough protection, because they're at higher risk. So we want to make sure that they develop those antibodies and get enough protection from the vaccine. So yeah, any children aged between 2 and 9 that have underlying health conditions but have never had a flu vaccine before, so if it's their first time having it, then they need to have a second dose. So not many, but worth mentioning just in case.
Yes, because sometimes it's really hard, especially for some of the parents, if their child turned 2 or 3 and have at risk, are on at risk groups, and they've been offered, oh, okay, your child need 2 vaccines. They will say, no, we don't. Everybody's having 1 vaccine. Why my child is unique to have 2 vaccines? Because it does have the problems. So one of the biggest questions people always ask, especially for kids, are vaccines effective for kids?
Yeah, so there's shown really good effectiveness with the vaccine. Unfortunately, we can't claim that it completely stops people from contracting or getting the flu. We would love to say that, but we can't. But what it does, similar to the COVID vaccine, is it prevents severe illness. So if you had a child who maybe did still get flu, but they'd had their vaccine, they're much less likely to go to hospital. They're much less likely to be severely ill and have a very mild case. For most people, they could just completely not get the flu at all from having their vaccine. But if they did get it, and there is a small chance, then it's a lot lower side effects and complications from flu for those children. So it's still worth getting that protection to them.
Indeed, definitely. And sometimes all children's need is these kind of protections. Now, if we talk about flu, and I know this section is more devoted towards the kids, but sometimes adult people also concur on that kind of things. So on the other day, because one of very good friend of mine was asking, he's in a late age groups, and he was saying that why I'm getting a different flu vaccine as compared to my son, who is younger than me. So is there a different kind of vaccines offered to adults as well?
Yeah, so people who are age 65 and over get given a different vaccine. And this is because it's shown to be more effective in their age group. So when there's been trials and things done, it's people age 65 and over don't respond as well to the vaccine given to everybody else. So they have almost a special vaccine as such. So that is to offer them the best protection for the elderly who might have that weakened immune system, who might be more vulnerable to flu. Those are the people that have a slightly different vaccine, because that's shown to be how the vaccine's made is shown to be much more effective in the elder population. But for younger people, they can have the other vaccine. Yeah. They're very complicated.
Exactly. Sorry, there was a question I was trying to see what to say. Sorry, I think so. There were a few comments made at the time and I was glitching completely.
Oh, okay. Yes.
Sorry, there was few comments comes in play, so I was literally seeing through if there's any questions there, and yes, there are some questions there, but then they are unfortunately in regards of that. So when for adults, when can they start having their vaccines, and why it's important for people 65 plus to have vaccines as well?
So that's already started. So that was from early September. And again, the people aged 65 and over, lots of them do have those underlying health conditions, might take medications for different things, have heart problems, diabetes, stroke, those sort of things that can make them more at risk of severe side effects of flu. So that's why all the elderly we encourage to have. And it's very important to say that this year we are expecting higher levels of flu around, because last year we were all distancing and only meeting in small groups, and there was lots of restrictions in place, and that meant that the flu levels were much lower than normal in a year. So this year we're expecting people to be even more at risk of flu, and more flu going around our communities, which is why we're really stressing the importance of everybody who's eligible having those vaccines, especially those who are elderly as well.
And on that note, I must say, wow, the time has passed really, really quickly. I can see that we are about to approach to end the show in about a couple of minutes' time. So I'd like you to give a positive message to all our lovely listeners, and encourage them to get some flu vaccines.
Yeah, so if you have any doubts or any questions and you're not sure which categories or what you should be having, please do speak to a health professional. The flu vaccine is very safe, very effective, and is worth having for anybody that's eligible. And we really encourage you to take it up. As we've been talking about pregnant women and children, we really want to protect those in our communities who really need the protection from flu. So please take up your vaccine. Speak to doctor, nurse, midwife, or pharmacist if you're unsure of anything.
Indeed, and this is this vaccine is for our protections. We use the vaccine for our own to safeguard ourselves and our loved ones. And as Rachel said earlier, that we need to safeguard our elders as well. Sometimes having vaccinating children or pregnant women are not just vaccinating themselves; they are safeguarding all their people who are around them. So on that note, I must say thank you so much, Rachel, for joining us today, and thank you so much for sharing those extremely helpful advice and guidance. And thank you so much for coming to our show.
Thank you for having me.
Thank you. If you missed any part of the show tonight, please don't worry. You can always catch us up back on Inspire FM Facebook page or live link. Otherwise, or you can go to the web page and Inspire FM web page and listen to the show as well. Please do remember us in dua, in your duas, and do remember to log in next week as well. I'm Fahad Matin signing off. So until next week, we will hope to meet again. And on that note, I must say thank you so much, Rachel, for joining us. We will meet again, hopefully again. You will be invited again. So thank you. Take care. Bye-bye.
Thank you. Bye.